we are going to discuss a bloodborne pathogen control measure or the control measures for the bloodborne pathogens. The objective of this study include the followings. First, we are going to identify who are the workers who are at risk of exposure to the bloodborne pathogen and identify the key aspect of a bloodborne pathogen exposure control plan. Then we are going to describe methods of controlling exposure of the bloodborne pathogen and describe the steps of post-exposure prophylaxis. Who are the people who are at risk of occupational exposure? The people who are working in healthcare worker or in the medical field, they are more likely to expose to different types of bloodborne pathogens. These occupations include physicians, physician's assistant, a nursing staff, nurse practitioner, and other health worker employee in hospitals and clinics. Also, it includes people who are working in clinical and diagnostic laboratories for HIV and hepatitis B virus or hepatitis C virus, or people working in laboratory research or research for these infections. Also, it also includes people who are working at hospital laundries or in the commercial laundries that do laundry for healthcare or public safety institutions. Also include people working at blood banks and the plasma center who collect and transport and blood test. Also individuals working at hemodialysis clinics, people working in health maintenance organization clinics, also family planning clinics or birth control clinics because they are dealing with mucous membrane during the insertion of certain birth control measures, such as the intrauterine contraceptive device. Dentist or dental hygienist or people working in with the dental in the dental clinics, employee handling and regulating waste, the waste of the hospital, especially the sharps, which may be contaminated with these pathogens. Employees who service and repair medical equipment, especially the laboratory equipments, and the maintenance of these equipment, or it is regarded sometimes it is polluted with infection, so it may cause transfer of the infection. Emergency medical technicians and paramedics and other emergency medical service provider, usually in the emergency department, immediately they try to interfere with the patient to survive the patients before trying to make any screening for different infection. So these people who are working at the emergency department, they are liable to have the infection. How can an individual have or got the infection during his occupation in the workplace? So, workplace transmission of bloodborne pathogens can occur in a number of different ways. That means how an individual working in the health work as a health worker, how can he got the infections? This can be if the individual or the patient have the infection, so his blood is contaminated with these viruses, different types of viruses, or if there is a direct role of entry into the body through mucous membrane, such as in the eyes, nose, or mouth, through non-intact skin. So either the individual got the infection, if he have contaminated immediately with the blood, which is contaminated with the the virus, or if there is contamination through broken skin. The skin and the mucous membrane, they are regarded as the first defense mechanism of the body. So if there is contamination of the mucous membrane or not a non-intact skin by these viruses or this material which contain the virus, so it will cause the infection. Through injections or punctures or lacerations from contaminated sharps, the materials or the equipment which are used for a patient who have the infection, and if it is contaminated with the virus, so it can transfer the infection to the health personnel. Or sometimes the transmission also occur through direct contact with surfaces or materials contaminated with the infected blood or bodily fluid, and from contaminated or saturated bandages or dressing. If the health personnel or health worker have a contamination or direct contact with the materials which is used for dressing, for example, or bandages which is contaminated with the blood or the serum of the patient, so this depend on, this will cause act as a source of infection, and it depend on how long the virus survive on these surfaces outside the human body. How patient got the infection. Sometimes the patient come to the hospital and he got the infection at the hospital, so he have the infection while he is treated by different medical personnel, and this is what we mentioned previously. It is called the nosocomial infection. The infection got because of the treatment at the hospital. So how a patient exposed or got the infection in the hospital? So this may be due to the use of improperly sterilized equipment. If the patient is treated or he is managed by the use of unsterilized equipment such as unequalized syringes or other instruments which are used for surgery. Unsterilized injection fluid. Sometimes the fluid system, sometimes it is contaminated. If it is contaminated or used by it is contaminated by the virus, and previously used by for another patient, for example, especially in the emergency. So this will cause the infection, transfer of the infection to others. Or contaminated infusion. If the infusion, whether it is a blood transfusion or if the fluid transfer to the patient, it is polluted or infected with the virus, so it causes the transfer of the infection, especially if the blood from the donor, which sometimes there is no time for screening of the blood among donors who give blood, especially in the emergency unit. So if this blood from the donor which have the infection, so it transfer to the patient. The organs, also organ transplantation, it should be screened for these infections because it is regarded as a source of infection if it is not screened, such as, for example, renal transplant or bone marrow transplant, cornea transplant, liver transplant, or liver heart transplant, or sometimes in the developed countries even the lung transplantation. So all these organs should be screened for these viruses before the transplantation. Blood of infected health worker during invasive procedures. If the doctor or the nurse or a health worker has the infection or he is a carrier of the infection, so he can transfer the infection to the patient through invasive procedures. Hemodialysis. Hemodialysis, it is one of the important source of these infections, especially if the hemodialysis system used by a previous patient who have the infection, and if it is not sterilized, so it will transfer the infection to the other patient. Another important exposure is during the tattoo. Tattoo, which is one of the cosmetic procedure which is used at different clinics or different hairdresser or different procedure which is performed, and this is regarded as a source of transfer of infection. Also, another cosmetic source of infections is the Botox injections or the filling. The filling used for cosmetic in some patients, so in some individuals, so it is regarded as also as a source of having infection. So the prevention of blood-borne pathogen include the main points in the prevention include practice standard precautions. Every practice, every clinic, every institution, they should have what is called the clinical standard procedure or practice standard procedure or precautions to prevent the infections, and we are going to discuss this point. Also, it is important to deal with all fluids or specimens or tissue as potentially infectious. As a medical personnel or health personnel, you should deal with all the specimens as they are potentially infectious or contain this infection, and you should take the precautions to take care to prevent these infections. Screening of blood, organs for transplantation, and tissue donor. As we mentioned, it is important to screen for the blood, for the plasma, or for the platelet, for the organs and other tissues for transplantation, because it is regarded as a source of infection. High risk behavior modification. We mentioned in the first lecture that the people who have risky behavior, such as the promiscuous sexual relationship or extramarital relationship with individuals who have the infection, especially if they have multiple partners. And also, it is important to modify the behavior of people such as the drug addicts. We mentioned previously that one source of the infection is the use of the intravenous drug or the addiction on some drug abuse, especially if they use the same syringes, and this will cause the transmission of the infection to other people. Blood and body fluid precautions. Always, there are certain precautions to deal with the blood and body fluid, especially in the transportation or in dealing with in the laboratory or in the research. So you should be very careful in dealing with these material. So there are what is called a universal precautions. The Occupational Safety and Health Administration, the abbreviation which is called OSHA, defines universal precautions as an approach to infection control to deal or to treat all human blood and body fluids as they are potentially infectious or contain blood-borne pathogen. As we mentioned previously, always deal with this material as it have infection, and you should have these precautions. So this is called a universal precautions according to OSHA. Deal with all fluids as they are infectious material, and you should have these certain precautions and protection when you are dealing with this material. So the universal precautions include the following. First, vigorously washing hands before and after exposure to blood and other body fluid. Always washing hands before and after dealing with these materials. Healthcare providers should always wear the personal protective equipment, which include gloves, masks, gowns with the long sleeves, eyewear protection or shield covering the face. So all these called the personal protective equipment, and it is important to be supplied to healthcare individual. Also, the use of practice control, work practice control to limit exposure to potential bloodborne pathogen. As we mentioned, there are special practice controls, practice control during the workplace in order to prevent or decrease the exposure to bloodborne pathogens. In correlation with the Universal Precautions, OSHA has compiled a set of regulations known as Bloodborne Pathogen Standards that requires employee to. So, according to OSHA, it is important to have certain precautions for the prevention of bloodborne pathogen, such as establish an exposure control plan. Every institution should have what is called exposure control plan, so in which it will put a job classification in which workers have occupational exposure to bloodborne pathogens. That means it have or it put list according to this exposure plan, control plan. Every institution should classify the jobs or job prescription and give the jobs for each individual to know if they will be exposed to the, if they have the risk to for exposure to these pathogen during these jobs. So it give a classification or job classification for those people who are going to be exposed to these infections, as well as they should put a larger a list of a procedure performed by those workers that result in their bloodborne pathogen. So it put a list first, put a list for the people, for people or job description who are going to be exposed to the these pathogens or having a risk to have the pathogen, and then they should put a list of a procedure performed. How are they going to deal with this infection if they are exposed to during their work? So, and this plan, this standard or practice plan should be updated annually if there are a new update. The second point is that at the work practice they should implement what is called the universal precautions. We have already mentioned above that the health worker should deal with all fluids as a potentially infectious or having the infections. Provide personal protective equipment, as mentioned before, include the gloves, the eyeglasses, long sleeve gowns, and mask, in addition to shield, face shield to cover the face. And this is important in dealing with certain infections. Provide hepatitis B vaccination to workers who have expositional risk to bloodborne pathogen. Every individual, before they start their practice in the medical field, they should be sure about their immune status regarding hepatitis vaccination, because it is important to have hepatitis B vaccine if you are not protected. So you as a medical student, when you are going to transfer to the clinical practice after the end of the third year and starting your fourth year, you are going to be tested for hepatitis B vaccine immunity. If you are not immune, so you should have hepatitis B vaccine before 10 days at least before your first assignment in your job or in your clinical practice, and we are going to explain that in detail later on. There is no vaccination against hepatitis C or HIV virus. Provide post-exposure evaluation to any worker who experiences an exposure accident. This is what is called the post-exposure prophylaxis. We are going to explain this later on. Education of the healthcare provider about the risk and the prevention of bloodborne pathogen before starting clinical practice. Every health worker, they should be educated about the risk and how the method of prevention for the bloodborne pathogens. As an institution or a hospital or a clinic, there are certain what is called the engineering and administrative controls. We mentioned the infection control at a personal level, but at an institutional level, or there is what is called the engineering and administrative control methods. It includes the following. First, hand washing. Always we are hand washing for people who are working in or dealing with patients, screening of blood donors. This is a very important system which should be followed by all the institutions. Hand washing, screening of blood donors or other organs, as we mentioned. The use of sharps placed in sharp label container. Always there are special containers, red containers. This is for sharps. So the wastage of the sharps or the materials which are used for patients who have the infection, it should be placed in special containers with the marker of the biohazard, a special biohazard mark. Put it on this sharp container, and it should be dealt and transported with a special care. Safety devices used such as needles and scalpels. So it is important to always sterilize the instrument which are used by surgeons or by nursing staff who are dealing with the patients. No recapping used needles. This is an important point in dealing with in the prevention of these infections. Usually, as you see in this slide in the middle, we are always using the syringes with the cap or with the cover. And always after the injection, we try to recap or put the cover over the syringe after we did any procedure with or giving an injection to the patient. This is increasing the risk of accidental sticks or bricks. So we should not use this practice. We should not recap the syringes by our two hands, but there is a special method for recapping or putting the cover over the syringe, over the needle. We are going to discuss this later. The method of recapping. So never ever recap the syringe by both hands, but there is a special method for recapping before disposal of the used syringes. Transporting lab specimens in secondary containers. Always have special containers for the transportation of the laboratory specimens, because it is a risk, as we mentioned, it is regarded as a risk for transferring the infection. So the individual who are working in the laboratories and in the transportation of the specimen, they should be very careful in dealing during the transportation. Using biohazards label or red containers, as we mentioned. Always you will see this in the health clinics or hospitals. Always you are going to see special containers and this biohazard label on the places where there is a risk of instrument contaminated or the laboratories. So it is important to understand what this means. This biohazard label, it means that this place or this container contain materials which is contaminated with infections. Handle used contaminated items with the protective gloves or personal protective equipment always. Do not deal with any instrument or any material without wearing the personal protective equipment in general status. Always clean and disinfect used equipment. It is very important to sterilize or disinfect the material which are used in dealing with patients who have an infection. Also, cleaning the places, all the surfaces should be disinfected by certain disinfectant, and chlorine. It is an important material which is used for as disinfectant. Handle used contaminated items with protective equipment, as we mentioned, disinfection of the equipment. Personal protective equipment provides and cleaned and always disposal by certain employers. So the personal equipment, for example, the mask, the gloves, the gown, they should be displaced in a special container, and the reusable one, it can be laundered by special places. Do not eat or drink or apply cosmetic or handle contact lenses where there is reasonable risk or likelihood or exposure to the blood or body fluid. So always in the places where there is a risk, where you are working in a place who have a biohazard or risk of infection with these infections, so never eat or drink or put cosmetic or eye contact in that place, because there is a risk of contamination in the mucous membrane, so you are at risk of having the infection. Always apply lotion to wash the hands to replenish oils and prevent non-intact skin. Hand washing procedure. We're always talking about hand washing. The hand washing procedure, it should be appropriate for a period of time, and by using the soap and washing gels for at least 20 seconds. Sometimes it is difficult to count the 20 seconds, but they mention that you can sing happy birthday twice until you finish. So the strategy, and it is always, it should be in a vigorous water washing using soap or materials for hand wash. In addition, washing the inside, the outside, between the fingers and between the fingers and the nails. It should be cleaned for at least 20 to 40 seconds to ensure that it is clean from any pathogen or on surface. So this strategy demonstrate, always we should demonstrate this proper technique for all people who are going to work in the health as a health worker, or you can teach all that for your family. This is an important aspect in the prevention of many infections, not only the bloodborne pathogens. So always put the material such as soap or hand washing gel, always it is present for the people who are going to wash hands. So make the material easily supplied or maintained, and monitor compliance. Always monitor the health worker for hand washing. Always remind them, and always see that they are really wash their hands before they use or when are becoming in contact with patient. Always make what is called the role modeling. You as a supervisor or as a consultant, you always make you are regarded as a model for your trainees. So you should wash your hands and explain that to the workers. So always encourage this with all employees and customers and family members, visitors. This is an important health education point regarding hand washing. This a constant messages. Always put a messages or posters for the people in different places to remind them how to wash the hands, as you see in the down in the corner in the right corner down corner of the slide. Providing adequate facilities and materials, as we mentioned, and monitor the use of consistent prices, as well as we need to practice this every day, every time when we are dealing with patients. One of the important aspects in the prevention is the post-exposure prophylaxis. If an individual exposed accidentally during his work to these infections. So what is the post-exposure prophylaxis? This is a very important plan in the prevention of the infection. What is the individual going to do when he is exposed to these infection accidentally during his work? So when there is a suspicion that you have, for example, accidental sticks during dealing with a patient, or you have a risk of exposure during dealing with a suspicious case of these infections, first aid is needed. Always try to wash the place vigorously with water and with soap, and flush involved site with disinfectant immediately after you have the exposure. Then it is important to notify this accident to your superior or supervisor. And the most important one, to identify the source person or from whom you got the infection, because we should put alarm on this individual that he is a source of infection, and it is important to counsel and follow up this individual to prevent the infection to other people as a source of infection. So there is a special injury form which is present in each institution, and keep your notes on this injury form, and a follow-up care and evaluation and counseling is needed, which include laboratory testing. Every individual exposed to any suspicious case of infection, so it is important to have certain laboratory tests. Then we are going to start appropriate prophylaxis treatment according to the type of the infection. Also, there is a special laws and regulations should be followed. Option written for regarding the treatments, and record keeping of the events. It is important to record the events. It is important to register this accident as a source of infection. So the post-preventive prophylaxis, it is important. There are certain strategies and depend on the suspicious virus, whether it is hepatitis B or HIV or hepatitis C virus. So hepatitis B vaccine, it is important. The pre-exposure, as we mentioned previously, pre-exposure, every individual who is going to start to have a work in the health working as a health personnel, he should have his immune status should be tested before he started his work. So if he is not immune against hepatitis B, so he should offer the vaccine, hepatitis B vaccine, 10 days before the beginning of his employments. And this is the regime or the schedule of this vaccine should be as follows. 3 injections over 6 months. First dose, which is regarded as 0 dose. The second dose after 1 month and 1 to 2 months, and the third dose, it should be and not before 6 months. So within the 6 months, he should have 3 doses of hepatitis vaccine. So it is important to verify seroconversions 30 days post immunization. After the immunization with hepatitis B vaccine, he should be tested for hepatitis B surface antibody. If he is immune, so if he has these antibodies in the blood, so that means he is immune against the hepatitis B vaccine. But unfortunately, some individual, they will not develop these antibodies after 30 days or after the schedule of vaccination. So re-immunization with the complete series or another 3 series should be given, or 3 shots should be given to the individual. And then we are going to retest the individual for the hepatitis B surface antibody after 30 days after the completion of the second series. If the employee does not demonstrate immunity, so he is considered as non-responder and non-immune, or he have no immunity against hepatitis B virus. If he exposed, this individual, non-converter, if he exposed to active hepatitis B virus, so we should deal with him in the following way. First, we are going to give hepatitis B immunoglobulin, which should be received as soon as possible when he is exposed to a case of hepatitis B positive source patient, and the efficacy dependent on the type of exposure. So, if the individual who are what is called the non-responder or the non-converter, if they exposed accidentally to an infection, so immediately we are going to give hepatitis B immunoglobulin. And then, for example, we are going to give him 2 shots of the immunoglobulin, one as soon as possible after the break of the accidental sticks or exposure, followed by another one which is at least 1 month. And this is approximately affected up to 75%. So if the patient, those who are non-responder, who are non-immune against hepatitis B, they should be, if they exposed accidentally to infection, we are going to give him 2 shots of immunoglobulin, one immediately after the exposure, and the second one is after 1 month. While individuals who are exposed to hepatitis C virus, there is no vaccine against this virus, and the patient, he will got the infection, but he should be very cautious and use the procedures which is mentioned before to prevent the infection. What's about HIV virus? If the individual have exposure to HIV virus, so it is important to have a post-exposure testing. If an individual exposed to a patient who have HIV virus, so the individual should be tested for HIV at intervals of immediately or within 1 to 2 hours, and then at 6 weeks after the exposure, and at 6 months after that. So he have 3 testing. One immediately within 1 to 2 hours after the exposure, then after 6 weeks, and this is followed by a 6 months testing for the virus. So he should have a pre-testing counseling and post-testing counseling. If an individual is exposed and he showed a positive exposure after testing for HIV, so usually we are going to give him antiretroviral agents, which are used in combinations is most effective if started after 1 to 2 hours or up to 72 hours after the exposure. So if the individual exposed to HIV and he tested positive, so we are going to give him a combination of antiretrovirus and agents within 1 to 2 hours or up to 72 hours after the exposure. We are going to give him a 28 days course of medications, which is known as post-exposure prophylaxis, which may be provided after an exposure to reduce the chance of HIV transmission. The decision to use the PEP is made by assessing a clinician. As we mentioned previously, that the HIV virus does not survive well outside the body. So drying HIV infected blood or other materials which contain have the risk of transmission make it nearly to zero. One of the important procedure is to prevent these viruses or this infection to the people is by what is called reducing unnecessary injections. As we mentioned, injections, it is the most important risky procedure for the transmission of the infection. According to the World Health Organization, it proposes a national strategies for the safe and appropriate use of injections address behavior changes among healthcare workers and patients. So there is a myth which is followed by some individual patients or health worker that injection is faster in the management or have the relief or the management quicker than the oral or other way of management. So it is important to have the national strategies which is proposed by the World Health Organization for the safe and appropriate use of the injections. It has been estimated by the Safe Injection Global Network, or the abbreviation of SIGN, estimated that approximately 16 billion injections are performed annually, many of which is unnecessary. Many of these injections, they are regarded as unnecessary for the people. So it is important to educate healthcare worker, patients, and public about injection risk. It is very important. This is this point about the education of not only the health worker but also patients about the risk of injections. So this educational material is by developing teaching materials about injection risk and the importance of reducing injection frequency. So as injections, they are the portal of the infection, transferring of the infection to the patients. So, and it is also a risk, as mentioned, for the health worker. So it is important to educate people, not only the health worker, but also for the people or the public, that it is important to be aware about the risk of injection and the importance of reducing the frequency. If you reduce the frequency, so you decrease the risk of exposure. It is important to enlisting or enforcing influential institution. We can enforce this educational material in a campaign or institution against unnecessary injection by some influential people, such as in mosques, in churches, in universities, in hospitals, and any governmental agencies. We should provide this educational material by or among these institutions to educate people about the risk of these unnecessary injections. When available, teach how to use safety devices and the proper disposal of all single-use devices. If it is necessary to use these injections, so it is important to teach the use of safety devices. Always use sterilized equipment and the proper disposal of these single devices after the use. Eliminate the use of unsterilized needles, syringes, and solutions for injections. Always a proper disposal, as we mentioned. Monitor surveillance of occupational blood exposure. It is important, there is a monitor system to track occupational exposure of to bloodborne viruses should be introduced. Always there should be a monitoring system or registration of all these exposures during occupation, because it is important to know which individual who got the infection, and how are we going to prevent the transmission of this infection from these individuals who are already exposed. So all accidents should be reported and focused, and it is important to understand, as we mentioned, the risk during occupation and how are we going to change certain practices and increasing barrier precautions. Always change certain practices, as we mentioned, use appropriate and safe use of injections or materials, in addition to decrease the frequency of unnecessary injection and the use of certain precautions or barriers. So we can abbreviate the abbreviation, or we can put or summarize this the infection control by the following. First, there is what is called, this is the hierarchy of the prevention. Hierarchy of the prevention of the injury prevention or exposure to certain bloodborne pathogen. First, eliminate unnecessary injections or substitute sharps. Always, as we mentioned, eliminate the injection which are unnecessary, and always we should substitute sharps by using other system which is more safe. For example, they use the needleless IV systems or safer needle devices. If you can see in the picture in the top on the right side, that the use of the blood transfusions device or system, you can see the end of the needle. It is a plastic and it is not sharp, and it is blunt at the end. It is better to use the safe equipment. The second is the use a device with safety features to isolate sharps. So we put this red tanks with a biohazard label in order to prevent the exposure to these sharp materials. This is which is mentioned by the engineering control. The third way or strategy is the use of safe practices to reduce the risk of hazards. Always be safe when you are using certain practices, which is to prevent the infection. Standard precautions, as we mentioned: no recapping, provision and placement and removal of sharps containers, personal protective equipment, gloves, masks, gowns, and eye protection. The important point we always mention is the no recapping, because it is the most important risk where the health personnel or worker, they are exposed to accidental sticks. So to safely recap needles, use the one hand technique. This is when you give injection. Always use what is called one hand techniques, in which we are going to place the cap on a flat surfaces, and then remove your hand from the cup. Always put the cover or the cap on the surface, on flat surface, and then you remove your hand. Then you are going with the one hand to hold the syringe, as you see in the sequence of the step in the pictures. Then you hold the syringe in the other, on one hand, and use the needle to recap or to scoop up the cup. So put the cover on the table, for example, or on a surface. Then you handle the syringe or the with the needle and try to scoop the needle inside the cup by one hand. When the cup covers the needle completely, use the other hand to secure the cup on the needle hub. Be careful to handle the cup at the bottom, only near the hub, so you can see the sequence of recapping. This is a very important procedure which you can use even at home, at a place, when you are giving injections to other. The technique of recapping. So the recommendation for health workers, we can summarize the recommendation by the following. First, surveillance. Always we should know how many individuals they are exposed and register the cases or the accidental exposure to these infections. Training personnel individual about how to use different aspects, such as the removal of unnecessary, as we mentioned, unnecessary injections or certain precautions to prevent the infection, as we mentioned previously. Personal immunization, especially for hepatitis B vaccine. Always wash and disinfect hands and surrounding between patients. Provide appropriate personal protective equipment. Always use gloves when contact with body fluid and blood. Enforce safe practice through monitoring and supervision. Establish bloodborne pathogen management policy. And thank you.